student nurse today. Could you show me or tell me your name and your date of birth?
All right. John Spalding,
John?
12/13/88.
Okay, that's what it says here. And tell me about allergies. Do you have some allergies?
Penicillin and doxycycline.
Okay, and what happens when you take those?
Just a rash.
Okay. Well, we're not going to give you any of that, and that's what it says here. I'm going to be doing a quick head-to-toe assessment, so that will be looking at your skin and pulses and heart, lungs, and abdomen. And if you have any questions, let me know. I'm going to do my best to keep you covered private, so I'll pull the curtain here in just a minute. First of all, I see you have an IV, and that is supposed to be normal saline, and that's what it says here. And it's not expired, and it's going at 50 cc's an hour, and that's what my pump says here. And could I take a look at your IV site? Okay, great. There's not any redness or swelling. Looks like your knuckles are a little red, but we'll make sure that there's I don't think that's related to the IV, right? Any burning or anything?
No, just dry skin.
Okay, very good. All right, so you have told me your name and date of birth, but tell me now, where are you today?
I'm in let's just say the hospital.
Okay, good. And what is today's date?
The 17th of March,
Of what year?
2015.
And what time is it approximately?
About 10:05.
Okay, so he's alert and oriented to person, place, and time. Would you smile for me? Okay, his facial features are symmetric. Now I'm going to do something. I'm not going to gag you. I'm just going to look in your mouth in just a second. But first, I'm going to ask you a question. I should have done this ahead of time. Tell me, how many fingers am I holding up?
2.
Okay, and I want you to do something for me. I want you to, one at a time, put your finger on each nostril and breathe in, like that. Okay? Great. Okay, so he can see here and got patent airway. Okay, so I'm just going to look in your mouth, and I'm going to look at the sides of each cheek, and then I'll look under your tongue. Okay? So if you look in your mouth. Okay, stick your tongue out all the way, and then up to the roof of your mouth. Okay, great. Mucous membranes are pink and moist and no lesions. Are you having any pain today? And just if I were to ask more specifically to rate it, with 0 being no pain and 10 being the worst possible on that scale, how would you rate it?
A 0.
Okay, so he rates pain as 0 out of 10. Doesn't appear to be in any obvious distress, respiratory, or guarding. Okay, you step to the side now. I'm going to go ahead and listen to your lungs, and I'm going to come on this other side. So I'm going to have you lean forward a little bit. Okay, but I'm going to be back here. So every time I put my stethoscope in, every time I touch your skin with the stethoscope, if you would take a breath in and out through your mouth, a little deeper than usual, and if you get tired, just let me know and we'll take a break, okay? Doing okay there? Okay, we're going to do the lateral. Get this off my earring here. So I'm going forward. Okay, on this side. Okay. Okay, now I would lay you back a little bit. Okay. And we have a sheet here, which I don't have. Okay. This is going to be my sheet here. I'm just going to move your breast to the side if that's okay. Okay, very good. Okay, So breath sounds were clear, anterior, posterior, and laterally bilat with no adventitious sounds. And now I'm going to palpate, so forgive me, I'm going to uncover her. I'm going to just palpate on the mannequin to show my instructor where the landmarks are. So I'm first going to come down suprasternal notch, angle of Louis, second intercostal space, right sternal border is aortic, second intercostal space, left sternal border, pulmonic, third intercostal space, left sternal border, Erb's point, fourth intercostal space, left sternal border, tricuspid, fifth intercostal space, midclavicular line, mitral. So I'm going to go ahead and lay back down a little bit. So I'm going to be listening first with the diaphragm and then with the bell. And on this stethoscope, I don't have a bell, so I'm going to be listening with firm pressure and then light pressure. And what I'm going to do is do the first 3 here above the bra, and then I'll come up underneath and do the last 2 underneath the bra. So let's get you kind of ready here. So I'm just going to find my starting point. I'm just going to go back with light pressure. Okay, very good. So S1 and S2 were present. There was a regular rhythm. I did not hear any extra heart sounds or murmurs. I heard S1 loudest at the apex and S2 loudest at the base. Okay, we're just going to go ahead and lay you down now, and we're going to listen to some vowel sounds. Again, my makeshift sheet here. So I'm going to make sure I start in the right lower quadrant below the umbilicus. Back to the, if you're using a stethoscope that has to switch, be sure to go back to the diaphragm. Tap, tap. Okay, so right lower quadrant. Okay, we're not going to do any palpation or percussion today, so I'll cover you back up and sit you back up. All right, so vowel sounds were active in all 4 quadrants, and now I have my other patient come back. So I'm going to be looking at the skin color of your face, and it is a light pinkish color. And off my rings. So temperature is equally warm bilat on the face. Equally warm bilat on the arms and the hands. Okay, I'm going to check your radial pulses. Okay, those are 2+ out of 3+ bilat. I'm going to check your capillary refill. That is less than 2 seconds times 10. I'm going to do some range of motion, and so this first time through, let me do all the work. I'm going to feel your joint here, and I'm going to move it through flexion, extension, pronation, supination. We'll do that with the other arm. Flexion, extension, pronation, and supination. Now, can you do that with me? Flexion, extension, pronation, supination. Okay, and hold your arms like this for me, and let me don't let me push away. Push as hard as you can. Okay, and pull back as hard as you can. Great. So he has full range of motion, active and passive, with no crepitus bilat. Muscle strength is 5 out of 5 bilat. Now, for your patient, you would make sure the legs were rolled up, but I'm not going to do that to him. So I'd be observing that the color of his lower legs and feet was probably the same pinkish color that his upper body is. I would be, again, starting above the knee, feeling for temperature, all the way down. I would comment that temperature was equally warm bilat, or if the feet were a little cooler, I would mention that. I'm going to go ahead while I'm here and pick my pulse. I'm going to check dorsalis pedis pulse. This would be the right location, and if you don't find it, move it around. Okay, 2+ out of 3+ bilat. I would be actually checking his cap refill. Okay, less than 2 seconds times 10. I'm also going to be checking for edema under the skin. Under the clothes. Press and hold for 5 seconds about this area. No edema by lat. Now I'm going to do the same thing with your leg. I'm going to move your knee through several ranges. So let me do all the work here. So I'm going to move it back a little bit farther behind the bed, flexion, and extension. Same thing over here. Back, flexion, extension. And can you do those same movements? Okay, great. And now, same thing, if you will push as hard as you can against me, okay, and pull back as hard as you can. Great. So, range of motion of the knee. He has full range of motion, both active and passive, with no crepitus bilat. His muscle strength was 5 out of 5, bilat to flexion and extension. I think I've gotten everything. So I'm just going to have him lay back, and we'll put the side rails back out and lower the bed if I had raised it up. And here's your call light, and if you have any questions for me, just please let me know.